I stand before you and ask, has anyone stopped to think about what happens to people once they are hospitalized?
British Columbians experiencing mental illnesses in need of care and treatment can be hospitalized without their consent, when medical practitioners say their conditions may impact the safety of themselves or those around them. A recent bill from the provincial government would change the current language around involuntary care to help protect health practitioners from being sued by patients.
That's why the Mental Health Act, together with other pieces of legislation, affords the protection for healthcare workers here in the province in administering that treatment.
Hundreds of healthcare workers, however, are criticizing the NDP government in a refusal campaign, saying the proposed changes would do more harm than good.
Stripping someone of their bodily autonomy because of a perceived health risk to the public under the guise of public safety is ableism, full stop. Whether Alberta calls it compassionate intervention or BC packages it as involuntary hospitalization, what is being proposed is nothing more than incarceration in a new costume. It is a state-sponsored attempt to hide the massive failures of public services and community care.
SFU professor of substance use and drug policy Cora DeBeck says while intentions are in the right place, involuntary care is a misguided approach to treatment.
We just have so much clear evidence that that's not going to work and that's not going to help things. The other, I think, challenge too is, people may go into, involuntary treatment, but then what happens after that? We already know that there's no, such a lack of housing and such a lack of actual, interventions that will support people in the long run.
The Mental Health Act's provisions denying patients the right to consent to treatment are currently facing a charter challenge, and the province is committed to a full review of the act in the meantime. In Vancouver, Shailee Shaw, City News.